Hey everyone, welcome back. Here are the most commonly tested medications. Let's master the drugs that start with the letter H. How many do you recognize? Haloperidol is used to treat psychotic disorders, tics in Tourette's syndrome, and severe behavioral problems. Heparin is used to prevent and treat various types of blood clots. Hemophilus B conjugate vaccine SHIB is used to prevent serious infections caused by a Haemophilus influenza E type B bacteria. Hepatitis A vaccine is used to prevent hepatitis A infection. Hepatitis B vaccine is used to prevent hepatitis B infection. Human albumin is used to restore blood volume in conditions like shock, burns, and low protein states. Human papillomavirus vaccine is used to prevent certain types of HPV infection that can cause cervical cancer and other cancers. Hydralazine is used to treat high blood pressure, often in combination with other medications. Hydrochlorothiazide is used to treat high blood pressure and edema, fluid retention. Hydrocodone is used to relieve moderate to severe pain. Hydrocortisone is used to treat inflammatory conditions, allergic reactions, certain cancers, and adrenal insufficiency. Hydromorphone is used to relieve moderate to severe pain. Hydromorphone extended release is used to relieve severe pain requiring continuous, around-the-clock opioid treatment. Hydroxychloroquine is used to treat malaria, lupus erythematosus, and rheumatoid arthritis. Hydroxyzine is used to treat anxiety, tension, and itching caused by allergic reactions. Hyocinidamine, also known as scopolamine, it is used to prevent nausea and vomiting from motion sickness or anesthesia and to reduce secretions. Hyosamine is used to treat various gastrointestinal disorders involving spasm, irritable bowel syndrome, and peptic ulcers. Human chorionic gonadotropin is used to treat infertility in women and certain testicular problems in men. Hyaluronidase is used to dissolve hyaluronic acid dermal fillers. This is a significant use in aesthetic medicine. Let's keep going. Here are the adverse reactions of the drugs that start with the letter H that exams love to test. Haloperidol. Adverse reactions. Extrapyramidal symptoms, for example, dystonia, akathisia, Parkinsonism, tardive dyskinesia, sedation, orthostatic hypotension, dry mouth, blurred vision, constipation, urinary retention, neuroleptic malignant syndrome, rare but serious, QT prolongation, Haemophilus B, conjugate vaccine, HIV. Adverse reactions, pain, redness, swelling at injection site, fever, irritability, drowsiness, loss of appetite. Serious allergic reactions are rare. Heparin. Adverse reactions, bleeding, hemorrhage, heparin-induced thrombocytopenia, HIT, a severe decrease in platelet count, hypersensitivity reactions, for example, rash, urticaria, osteoporosis, long-term use, injection site irritation, hepatitis A vaccine. Adverse reactions, soreness, redness, swelling at injection site, headache, malaise, low-grade fever. Serious allergic reactions are rare. Hepatitis B vaccine. Adverse reactions, soreness, redness, swelling at injection site, fever, voice, headache, fatigue. Serious allergic reactions are rare. Human albumin. Adverse reactions, flushing, urticaria, fever, chills, nausea, vomiting, tachycardia, hypotension. Allergic or anaphylactic reactions are rare but possible. Human chorionic gonadotropin, HCG. Adverse reactions, headache, irritability, restlessness, depression, fatigue, edema, gynecomastia in males. Ovarian hyperstimulation syndrome, OHSS, in females can be severe. Human papillomavirus, HPV, vaccine. Adverse reactions, pain, swelling, redness at injection site, fever, headache, fatigue, nausea, muscle or joint pain, dizziness, fainting. Serious allergic reactions are rare. Hyaluronidase. Adverse reactions, local irritation, redness, edema, pain at injection site, allergic reactions, rare including anaphylaxis. When used to dissolve fillers, can cause temporary swelling, bruising or unevenness. Hydralazine. Adverse reactions: headache, palpitations, tachycardia, nausea, vomiting, dizziness, orthostatic hypotension, fluid retention, drug-induced lupus-like syndrome, especially with high doses long-term use. Hydrochlorothiazide. Adverse reactions: dizziness, lightheadedness, headache, weakness, nausea, vomiting, abdominal pain, photosensitivity, electrolyte imbalances, for example, hypokalemia, hyponatremia, hypercalcemia, hyperglycemia. Hydrocodone. Adverse reactions: drowsiness, dizziness, nausea, vomiting, constipation, respiratory depression, itching, dry mouth, headache, tolerance and dependence. Hydrocortisone. Adverse reactions: systemic use, fluid retention, hypertension, hyperglycemia, increased appetite, weight gain, mood changes, insomnia, osteoporosis long-term, increased infection risk, muscle weakness, adrenal suppression. Topical use: skin irritation, burning, itching, dryness. Hydromorphone. Adverse reactions: drowsiness, dizziness, nausea, vomiting, constipation, respiratory depression, itching, dry mouth, headache, urinary retention, tolerance, independence. Hydromorphone. Extended release. Adverse reactions: similar to hydromorphone but can include severe constipation, respiratory depression, prolonged effect, and risks associated with opioid tolerance and dependence. Hydroxychloroquine. Adverse reactions: nausea, vomiting, diarrhea, abdominal cramps, headache, dizziness, rash, retinopathy, macular damage, potentially irreversible, dose and duration dependent, cardiomyopathy, rare, neuropsychiatric events. Hydroxyzine. Adverse reactions: drowsiness, dry mouth, headache, dizziness, blurred vision, sedation, QT prolongation, especially with high doses or in susceptible individuals. Hyoscine, also known as scopolamine. Adverse reactions: dry mouth, blurred vision, drowsiness, dizziness, constipation, urinary retention, disorientation, confusion, delirium, especially in elderly. Hyoscine. Adverse reactions: dry mouth, blurred vision, urinary hesitancy or retention, constipation, tachycardia, dizziness, headache, nervousness, human chorionic gonadotropin, HCG. Adverse reactions: headache, irritability, restlessness, depression, fatigue, edema, precocious puberty in boys, gynecomastia in men, and pain at the site of injection. Hyaluronidase adverse reactions: local reactions at the injection site, for example, pain, redness, swelling, bruising, itching. Allergic reactions, rare including anaphylaxis, edema. Let's finish strong by doing the contraindications or black box warnings of the G drugs. Haloperidol. Contraindications: comatose states, central nervous system depression, Parkinson's disease, severe cardiovascular disorders, hypersensitivity to haloperidol. Black box warning: increased mortality in elderly patients with dementia-related psychosis, not approved for this use. Heparin. Contraindications: active major bleeding, history of heparin-induced thrombocytopenia, HIT, within the past 100 days, or in the presence of circulating antibodies. Severe thrombocytopenia. Uncontrolled active bleeding. Hypersensitivity to heparin or pork products. Black box warning: none. Hemophilus B conjugate, vaccine, HIB. Contraindications: severe allergic reaction, for example, anaphylaxis, to a previous dose or to any component of the vaccine. Black box warning: none. Hepatitis A vaccine, Contraindications: severe allergic reaction, for example, anaphylaxis, to a previous dose or to any component of the vaccine. Black box warning: none. Shirishem. Hepatitis B vaccine. Contraindications: severe allergic reaction, for example, anaphylaxis, to a previous dose or to any component of the vaccine. Hypersensitivity to yeast for some formulations. Black box warning: none. Human albumin. Contraindications: severe anemia, heart failure, hypersensitivity to albumin. Black box warning: none. Human papillomavirus vaccine. Contraindications: hypersensitivity to yeast for some formulations, severe allergic reaction, for example, anaphylaxis, to a previous dose or to any component of the vaccine. Black box warning: none. Hydralazine. Contraindications: coronary artery disease, mitral valvular rheumatic heart disease, hypersensitivity to hydralazine. Black box warning: none. Hydrochlorothiazide. Contraindications: anuria, hypersensitivity to hydrochlorothiazide or other sulfonamide-derived drugs. Black box warning: none. Hydrocodone. Contraindications: significant respiratory depression, acute or severe bronchial asthma in an unmonitored setting or in the absence of resuscitative equipment, known or suspected paralytic ileus, hypersensitivity to hydrocodone or any component. Black box warning: O addiction, abuse, and misuse. Risk of opioid addiction, abuse, and misuse, which can lead to overdose and death. O respiratory depression. Serious, life-threatening, or fatal respiratory depression. O accidental ingestion. Accidental ingestion by children can result in a fatal overdose. O neonatal opioid withdrawal syndrome. Prolonged use during pregnancy can result in neonatal opioid withdrawal syndrome. O concomitant use with benzodiazepines or other CNS depressants, risk of profound sedation, respiratory depression, coma, and death. O cytochrome P453A4, CYP3A4. Interaction. Concomitant use with CYP3A4 inhibitors may increase opioid plasma concentrations. Hydrocortisone. Contraindications: systemic fungal infections, hypersensitivity to hydrocortisone. Black box warning: none. Hydromorphone. Contraindications: significant respiratory depression, acute or severe bronchial asthma in an unmonitored setting or in the absence of resuscitative equipment, known or suspected paralytic ileus, hypersensitivity to hydromorphone or any component. Black box warning: O addiction, abuse, and misuse. Risk of opioid addiction, abuse, and misuse, which can lead to overdose and death. O respiratory depression. Serious, life-threatening, or fatal respiratory depression. O accidental ingestion. Accidental ingestion by children also can result in a fatal overdose. O neonatal opioid withdrawal syndrome. Prolonged use during pregnancy can result in neonatal opioid withdrawal syndrome. O concomitant use with benzodiazepines or other CNS depressants. Risk of profound sedation, respiratory depression, coma, and death. Hydromorphone extended release. Contraindications: significant respiratory depression, acute or severe bronchial asthma in an unmonitored setting or in the absence of resuscitative equipment, known or suspected paralytic ileus, hypersensitivity to hydromorphone or any component, opioid non-tolerant patients, for high doses. Black box warning: O addiction, abuse, and misuse. Risk of opioid addiction, abuse, and misuse, which can lead to overdose and death. O respiratory depression. Serious, life-threatening, or fatal respiratory depression. O accidental ingestion. Accidental ingestion by children can result in a fatal overdose. O neonatal opioid withdrawal syndrome. Prolonged use during pregnancy can result in neonatal opioid withdrawal syndrome. O concomitant use with benzodiazepines or other CNS depressants. Risk of profound sedation, respiratory depression, coma, and death. For extended release formulations, the following additional warnings typically apply. Potential for overdose with improper administration, for example, crushing, chewing, high potency, specific dosing instructions for opioid-tolerant patients only. Hydroxychloroquine, contraindications, known hypersensitivity to 4-aminoquinoline compounds. Black box warning, none, hydroxyzine, contraindications, early pregnancy, hypersensitivity to hydroxyzine, cetirizine, or levocetirizine. Black box warning, none but carries warnings for QT prolongation and torsade de pointe. Hyoscine, scopolamine. Contraindications, narrow-angle glaucoma, prostatic hypertrophy with urinary retention, paralytic ileus, myasthenia gravis, hypersensitivity to scopolamine or belladonna alkaloids. Black box warning, none. Hyoscyamine, contraindications, glaucoma, obstructive uropathy, for example, bladder neck obstruction due to prostatic hypertrophy, obstructive disease of the gastrointestinal tract, for example, paralytic ileus, pyloduodenal stenosis, severe ulcerative colitis, toxic megacolon, myasthenia gravis, unstable cardiovascular status in acute hemorrhage. Black box warning, none. Human chorionic gonadotropin. Contraindications, precocious puberty, prostatic carcinoma or other androgen-dependent neoplasms, prior allergic reaction to HCG, uncontrolled thyroid or adrenal dysfunction, presence of a sex hormone-dependent tumor, undiagnosed abnormal vaginal bleeding, pregnancy, should not be used once pregnancy is confirmed. Black box warning, none. Hyaluronidase. Contraindications, hypersensitivity to hyaluronidase or any of its excipients should not be injected into or around an infected or acutely inflamed area, danger of spreading infection, not for intravenous administration, not for topical use on the cornea. Black box warning, none.